So again, welcome. Today, I'm honored to, one of the things that's really great about our trainings at Mind Body Solutions is that people are coming from all over the place, even all over the world. And then there are people that are just starting to teach yoga, but then there's also people that are adding yoga that are already big knockers. They do a whole bunch of other stuff. And contrary to Sarah Brindle's, Dr. Brindle, she's a big knocker. She's been doing stuff. She's a rehab psychologist. I'm going to go over a little bit of her very extensive. This is what she sent me, 3 paragraphs. I'm going to highlight, and it's not because I don't think everything on this thing matters, but let me tell you. So she's got her PhD in counseling psychology from the University of Iowa. Puts her in the Midwest. It puts her in good company. We like that, actually. And she's a licensed psychologist. She completed her clinical internship at the VA in Long Beach. She has a postdoctorate fellowship at the Rancho Los Alamos National Rehabilitation Center. She gives counseling to both inpatient and outpatient people. She's been writing, her articles have appeared in a wide number of publications and books. She's also created a mentor program at the VA. They're support groups, but it's also, she's got a mind-body component of what she does. And I think that's how she found us. She came to our training because she was interested in yoga, but also in integrating that more directly and more profoundly was something she was already doing into her practice and looking for ideas. And so, but on top of all that, Sarah's got Dr. Brindle. I say, we call her Sarah. I'm going to work for Dr. Brindle because I want you all to know she has authority, right? She has authority and it matters, right? So and ask her a little bit what this is. She's a rehabilitation psychologist, right? Which has a specific focus that she's going to talk a little about. But then within that, she's got expertise in disability and sexuality in her practice. And so she's going to describe that. So Sarah, welcome. Dr. Brindle.
Thank you so much.
Welcome, right, to the call. And this is one of those topics that I'm telling you, sexuality is already hard enough, right? Then you add in disability and you've got an extra level of component for sure. But it's also, the other thing about what we're going to try to talk about is talk about sexuality within the continuum of touch, right? And we'll get into all these topics in a second. But for beginners, tell us what, to kind of position us in your expertise, what is rehabilitation psychology?
So rehab psychology is a field within the field of psychology that works with, and exclusively with individuals with disabilities. Could be a brand new injury, could be, across the lifespan in terms of living with disability. And, basically we work with folks to really try to maximize engagement in life, address barriers and, help people, lead a meaningful life.
So let me just put this in context. I was injured in 1978 at 13. And they had just hired their first psychologist as part of the rehabilitation.
Why do I know this is going to be a bad story?
Well, no. Well, my point is that it's an emerging field. Like now, after knowing what I know, I wish I had been able to be interacting more directly with someone like Dr. Brindle, right? Because the issues were happening. It was very funny because this guy interviewed me when he was 13, thinking about adjustment. I was just going into puberty, and he couldn't. I seemed fine. He didn't know what to do. So he just gave me one of the most graphic books on disability sex, because what he could imagine was that's where my 13 and 14-year-old brain was going to be, right? And so it was one of those books that I wonder if I could ever find it again. Back in 78, it was a little shocking for a young boy, but I'm so happy that the field, that the recognition of maximizing outcomes means more than just physical. It includes psychological, it includes social, and it includes touch. Because one of the things that gets really hard about living with a disability or acquiring one is that your life has been so fundamentally upended that you're not even sure how to interact with people, not just especially contact, and especially when your body's been so medicalized, especially when you've had to swallow hard and have everybody see you naked when I was 13 and have everything wide open. I mean, I imagine this is what moms mean, where you lose all propriety after you've had a baby. Everyone's been in, you know, I feel like somehow that happens when you've been medicalized as a patient, right? So I'm so glad that that exists. And I think it's funny that that was the one thing I got from my counselor.
You remembered.
Yeah. But so tell me, Dr. Brindle, how did you get from there, and do you have some reason why you were interested in rehabilitation psychology? Because I'm going to ask you about sexuality in a second.
Yeah, I mean, I actually was interested in becoming a physician and doing the medical school route. And through kind of my undergraduate experiences and then kind of working in a healthcare setting to kind of get my feet wet, I realized that I really enjoyed more the psychosocial aspects around living with health conditions. And that's really where my heart was.
Yeah, and so you go into that, and I know you've talked a lot, and then you ended up specializing not just in rehabilitation psychology, but then in disability and sexuality issues, and that came from who your mentor was, right? Or
yeah, so Dr. Linda Mona is my current supervisor and colleague, was my former clinical supervisor. And she's kind of nationally known in the field of psychology in terms of disability and sexuality, writing and speaking. And so, you know, I learned directly from her when I was.
Does she live with a disability too?
She does. Mm-hmm.
Does?
Yeah.
Is it a spinal cord injury or?
No, it's something that she's lived with since childhood.
Yeah, gotcha.
Yeah, and actually, in preparing for this call, I was remembering the very first rehab patient that I worked with that had a spinal cord injury, and I remember her just being this very like open person, and she brought up the subject of sex, which actually is not the norm. Usually, people are nervous to bring it up with their healthcare team, and I just remember her saying, oh yeah, well, of course I want to do that. And I was like totally new, you know, very green, you know, still in my training. And it was just so refreshing to hear her bring that up and have her feel like, well, of course I want to do that still.
That's awesome.
And I just, yeah, that just memory came.
And don't some of your interns, you have to go through like, to get them comfortable talking about it, they have to like, you have to do some funny training where they have to say
a bunch of
vagina, and they say it over and over again. So they can
exactly. Yeah.
And a desensitizing strategy. Because
exactly.
It's so natural and it's so stigmatized, not just with disability, but with human interaction.
Oh, absolutely.
And that's what I want to like, oh, by the way, and it wasn't before you started, you also, because I think this is just somewhat, it is interesting, I don't want to say somewhat, that you were already involved in empowerment issues and sexual expression, like in undergrad. So it was like, this was all a continuation.
I had worked at a women's health clinic, and we were really focused on, you know, women really learning more about their own bodies and not just being reliant on healthcare professionals to tell them what to do.
And so that naturally led into all of this. Okay, so
yeah,
everyone on the call just knows Dr. Brindle knows what she's talking about, right? And I've had a couple of preparatory conversations, and I'm amazed actually at all the different sides and components of issues of sexuality. So I want to step back for a second. And again, we're going to talk about the continuum of touch too, and the difference between sexuality and sensuality and things like that, and the similarities. But Dr. Brindle, like, why do you think sexual expression is so fundamental to the human condition? Mm-hmm. Like it matters. And by the way, it doesn't just go away because you're disabled, right? I mean, obviously. But let's take a step back and talk about it as a human issue, not just a disability issue.
Yeah. So, I mean, obviously, you know, we are hardwired to reproduce, and there's that aspect of you know, us having the capability of sexual desire and all that. But, you know, I think it really goes to our need to feel, accepted and, in this very vulnerable, intimate way. And then, kind of connected to that, I mean, just the value of touch in our lives. I mean, we know that babies who aren't touched, for months when they're born,
their neural nets literally don't form right. I mean, like,
right. It's like failure to thrive. And so we know that we will die without human touch.
Which when you take that in for a second, like,
Yeah.
again, I'm like a crazy philosopher. It's like, without the reference provided by touch, without the input of where you end and the world begins, without the realization of the interplay that can be between what's inside and what's outside, we literally don't function. I mean, it's like, it's one of those things that we kind of all know.
We shut
It's like,
down.
holy crimes. And that's something why we, swaddle babies. We wrap them in with a blanket and we sing to them to their ear and we rock them, because all those impulses are helping them know where their spine is, are helping them know where their midline is, and know where they end and where someone else begins. And what's so I just want to like talk about. And the other thing, and I was saying this to you, I called it right before because I was kind of warning her about some of these wider questions at first. And one of the things that really strikes me is that as an expression, as a form of expression, I want to get into why it's complicated too, but it's being seen and heard. It's interesting that needs to be more than just verbal, right? That, like, we need the contact to be seen and heard in our vulnerable places. But I also feel like somehow body contact and touch helps with the perceived sensation of loneliness. That in a way, whether it's sexual or not sexual, and being intimate at that level makes you feel like you're connected to somebody. But there's this other level of it that is it makes you, something settles, right? Like, say something about that from your smart.
When you said that, I just thought, like, you feel at home, right? Like, that settling is like feeling at home.
And that's also why it's so vulnerable, right?
Exactly.
Because if someone
you don't invite just everybody into your home.
and also judges it or is harsh.
Exactly.
I mean, you're incredibly tender where you're vulnerable. I mean, so from a human perspective, I think the line I have that you had said here is that it's a place to be accepted and seen, but also sexuality and intimate contact, whatever. We want to talk a little bit about the differences, involves taking risks and being vulnerable. Right? And that's going to be true across the human condition. So talk a little bit about what you mean by taking risks. I mean, we all kind of get the human vulnerability. And by the way, our society kind of sucks with vulnerability. And we've actually derided the body for like millennium, right? Like, so there's a whole bunch of stigma, but talk about the more practical risks.
Well, yeah. And I think our society sucks in general in terms of how we see sexuality. I mean, it's everywhere. And, we're worried about, young girls, especially, but young boys too, growing up in this judgmental society about bodies, and you should look this way, or you should look that way, or, oh, not this week. Now you're supposed to look like this, and then, adding that layer of disability on top of that, where, people have bowel and bladder issues, and they have, ostomy bags, and, things that already can feel, vulnerable and private. And
also, like, just to expand that out, not being able to move easily in a coordinated fashion, not having the ability to stay balanced enough to be able to even reach over and even hug somebody. So this is,
exactly,
like I'm paralyzed from the chest down, and if someone makes me lean too far to hug them, I'm almost on the ground.
Yeah.
Right. Like, so there are all these issues about having a body in close relationship to another body, whether it's sexual or not.
Yeah.
where there are the appearance things that their body doesn't look the way you want and all the societal things, but there are also some really practical things
Mhm.
about being able to reach towards somebody and do
So
it. You know, there's
there's,
all those
yeah.
other issues
So
too.
there's that safety vulnerability, like
Hmm.
physical safety, but then the emotional vulnerability, right? And, I mean, you take a chance. And I neglected to say at the beginning, but I am somebody who does not live with a visible disability. So I'm sitting down, but I just wanted to make that clear.
Hmm.
But, you know, uh, being naked for the first time with somebody, when you have various things that are different or different in appearance, and, I mean, it's a risk in terms of how that person may react. And of course, people have had really awful experiences around that.
Yeah.
And so it can really be this scary, anxiety provoking thing to even think about.
And you know, again, I'm talking more as a patient here, but like in a
Mhm.
way you get through that when you're in the hospital medicalized a lot because you actually have no choice. Like
Right.
you don't, in my opinion, process that very emotionally
Mhm.
well. You just accept it, right?
And
Like, you know.
and honestly, that's one of the reasons that I was drawn to taking a training with you all and really looking at that mind body relationship, with the folks that I work with, because so many people, because of that medicalization, sort of get divorced from their body. So it's like on a more permanent basis
Mhm.
that, because you have to get through, months, maybe, your whole life of having people look at you and, oh, you know oftentimes I'll come in.
Having 5 residents come in the room to all look at you,
Exactly, this whole team of
doctor, right?
people.
Because they're learning because you're such a freak show that like actually they're studying,
This is so
right? I mean,
interesting. Yeah, but I'll walk into a patient's room, in the hospital, and their sheets off of them, right? Like they're not getting. So I'll just say, I'll cue them and say, I'll give you a second to cover up, because there's no hair anymore. And I don't do physical exams on folks, so I see people with their
with their clothes on usually, right?
yeah, but like those kinds of things that people just get cognitively and emotionally separated from their bodies.
Yeah, so and I want to back up just for a second again to set the context of this,
Mhm.
and talking even more about disability, but the idea that what is the difference, for example, um, between just a normal good hug and an intimate hug or a sexual hug? Like,
Mhm.
how would you put that, the continuum of touch? Because touch
Yeah.
we've already established is essential for human beings
Mhm.
and a sense of isolation, right?
Yeah.
And not everything has to be sexual. Like one of the things I often say is the world would be a better place, especially for women, in my opinion, as a male, if
Mm.
males could understand the difference between sexuality and sensuality,
Mm.
that they actually are not the same thing and they don't always end up in the same place, right?
Mhm.
And that's a good thing. But how would you draw this kind of fuzzy
Mhm.
line when we're recognizing that touch is essential and then
Yeah.
there's sexual expression and sexuality within the continuum of touch?
Yeah. I mean, I think, it's really about the intention and the context, in that exchange. And so, yeah, I think a hug can be incredibly sensual, when it's in the context of an intimate relationship.
Mhm.
So, whether or not within that intimate relationship, those people are sharing what would be considered sex, by our society standards, that, even a touch on the hand, or, a touch on the cheek. I mean, that, um, you know, you could do that with somebody that's a friend, and it means,
Yeah, and it doesn't have to mean anything. I don't know if anyone
and you
remembers.
feel it differently. Yeah.
Um, I know I shouldn't bring this up, but there's people on the call. Do you remember the argument between Samuel L. Jackson and John Travolta about foot rubs in Pulp Fiction? It's hilarious, and it's exactly this thing. Like, do foot rubs mean anything or do they not? Well, it depends on how the people are receiving it. It depends on the intention. It depends on the context, right? Like, and that's the thing here is that our organism is wired to sense and feel things. both more tangible things that are physical, emotional things that are charged energy that have an emotional relationship to them, the ability to actually sense the space around our bodies. So like that's actually wired for us for threat. When you're, you know, when you're feeling that someone's standing too close to you in the grocery store line, you can feel it's kind of weird. That goes off when the context is different though, and it's for someone you haven't seen in years. You're so happy for the closing space. Like, and what's miraculous about our nervous system is that we pick up all of it and give it different types of meaning depend on the context, right? And that's part of what I think, I imagine in your work, that you're trying to help people have a more healthy relationship to the whole continuum of touch, and then to choose their sexual expression or what sexuality means to them. Do you find that to be the case, that you have to find out what sexuality means to each patient, for example, or is that, you know, does everyone just defer to it's got to be intercourse? I hope that's not the case, but you know.
I mean, I think it kind of depends on the context. So, you know, I do work with a mostly male population at the VA. So that's just kind of who, you know, our veteran population is. I do work with some women, and they tend to be, you know, on the older side. And so, yeah, I mean, I think there is definitely this idea that this is what sex is supposed to look like. And I think also just our society really has these, you know, scripted, you know, ideas or schemas in terms of, you know, what good sex looks like, or, you know, what sex has to involve. Well, it has to involve an orgasm, and it has to involve, you know, penetration, and, you know.
And these you think are actually fallacies, right? That this is what
Absolutely,
you think.
absolutely. Yeah. So, you know, I think one of the things I did want to talk about is just this idea that, you know, thinking, you know, like blurring the lines on those scripts is probably the best thing that you could do for your sex life as anyone with a disability or not, because once you sort of let go of those expectations, anything could really sort of fit into this idea of sexual expression around touch. So,
and then finding, and you also get to choose when you become more aware of it, I would imagine, and I think this has been true in my case, then you can choose, right? Like,
right.
you know, I'm gonna not touch people certain ways, but sometimes I'm gonna, you know, give someone a foot rub, right, just because their feet are sore, right? And that's a good thing. And how much, I want to just step back for a second before we dive into some of the more practical things, to then talk about how a mind-body connection or more mind-body awareness can be a way to make wonder and beauty and curiosity in the context of what is. I mean, that's what a yoga pose is, right?
Yeah.
There's more happening, and here's a great line from Prashant Iyengar. There's more happening in a yoga pose. There's more happening than you know. What you know, and what's happening may be more profound than what you know, because you have those expectations, you have those limitations built into your perspective.
Yeah.
And so it's part of like recognizing in human interaction in a yoga pose, right, that there is so much actually happening. Right? It's not just about certain things happening. It's about the exchange. It's about whether there's an energy level. It's about whether you can feel the space between two people. You know, like that your nervous system can do a whole bunch of stuff. And where and what parts of your being you open to those experiences.
Yeah.
Right? Like, and that's something you learn to actually interact with. Which is really, really part of what you're saying about it's not just blurring societal definitions, it's recognizing what's happening in your body. And some sort of mind-body connection or yoga or mind-body practice is exactly practicing you knowing the happening that you weren't always aware of. And to me, at least in yoga, for a yoga pose, that's where the beauty is It's not whether I can stand on my head. It's whether I can feel what it is to have energy move through the whole system. Or for example, a mind-body connection and mind-body practice might help you not only, like we talk about how it's that the subtle body, the more subtle part of your awareness travels through the sensation of relief.
Mhm.
Well, it'd be a good skill to have for sexual expression to be able to have pleasure fill your whole body. And that doesn't something that happens to you. It could maybe once or twice in your whole life, but there is the ability to work with your nervous system and your mind body system where you get good at having the emptiness in you feel full. Right. So I just want to, as we circle back to some of the ways that yoga can help, it's not just becoming more mindful of what you're already experiencing, it's putting your brain in a more kind of like shavasana, in a more neutral pattern. So it receives more input. So you're not caught so much in your head, like trying to fulfill your societal expectations of what sex is, right? So this is some of the ways that a mind-body practice and yoga practice can help. But Dr. Brindle, I want to back up to some practical things where we've already mentioned some of them that kind of set the landscape a little bit more about the types of things, and I have more questions that your patients, when they come to you with questions, I mean, I have in our conversation 9 things written down that you actually said, here are some typical things that. So give us kind of the overview of some of the issues that you see and are trying to help people with.
Yeah. So, we've talked about, some of the issues around stigma. And I think, just in general, I mean, I'm glad all of you guys are on the call because, this is something that it's a sensitive issue, and it's not something that people necessarily feel comfortable talking about, bringing up with healthcare providers. It's just, we're not taught to really talk about sex in an adequate way.
So didn't you just tell me a story about the guy that finally, one of your vets that finally met with a guy psychologist that finally had the courage to bring it up?
Yeah.
So it's a good story. Let's tell that story a little bit.
Yeah. So one of my interns actually was working with a gentleman, I think he's maybe early 70s, and, was going along great. He had just finished rehab and was transitioning back home. And so she was providing support during that time. And this patient then was seen by one of our male psychologists to do kind of like, we have everybody do an annual evaluation where they're seen by different disciplines, just kind of like an annual checkup, and psychology sees them as well, just for a brief screening. And so he ended up, when the provider asked the sex question, he said, well, yeah, actually, there's some things there that are bothering me. And turns out he hadn't brought them up to the female therapist. And so, he just kind
of it, having the courage, not just to talk about it with your intimate partner, right? Which is hard enough. That's a whole other level.
Right. Exactly.
But also being able to talk about it with healthcare professionals, or if you're in therapy and counseling or whatever, or your PT or whatever.
Yeah.
Like that's courageous too.
Yeah.
Right. And you got to get comfortable with that. So stigma is a big thing, and it keeps us all quiet. Right.
Yeah. And for me, I mean, as a healthcare provider, that's something that I really stress with my trainees. It's included in every single evaluation that I do with patients, because it's part of quality of life. And so, my soapbox is, if there are providers on the call, ask about it. You don't have to know the answers to everything about it, but if you're at least asking about it, you can get this person to, to somebody who might know some answers for them.
Yeah. So, and you also talked about things like body image, like talk about the issues you see there.
Well, and we've talked a little bit about, kind of bowel and bladder issues, or, different accoutrements, that somebody might live with, that may feel, shameful, or, to hide a certain part of your body, or, just all those issues around appearing different. And, people have different relationships with those differences.
So I remember one of the
Neutral.
things that,
Yeah.
that yoga helped me a lot in, and I don't know if this is really a body image or a filling of my vessel. That is my
Yeah.
body. It's like I remember one of the big benefits of doing a yoga practice in the first couple of years is that I started to be able to. I never felt for the longest time. I just felt like I was talking from my injury up, and I remember the sensation that and noticing finally the change of sensation that I could talk with my whole body. Okay, so that everything was moving in a coordinated fashion.
Yeah.
This is an essential realization, in my opinion, for sexuality, right?
Yeah. Oh,
Is to
absolutely.
recognize your whole body is doing the giving and receiving, to
Mhm.
feel like you're an integrated whole, not
Yeah.
just dragging in with a spinal condition, not just dragging a part of yourself away. So practices in which I press down through my feet in order to come forward in a pose is
Yeah.
actually setting the neural pathways and neural nets for all my interactions to feel like they
Mhm.
include my whole body.
Yeah.
Right. And so whether that's body image, I mean, I think we operate with the body image. It's not just the social one. It's
Mhm.
literally how we inhabit our flesh.
Absolutely.
And do
Yeah.
you do it the whole way? So I don't know
Mhm.
if you include that in the body image stuff, but it's like
Yeah,
it's related.
definitely. I mean, I think I had talked earlier about kind of that experience of, separating cognitively and emotionally from your body. And particularly for somebody who has like complete paralysis, and lack of sensation, in the genital area or other parts of the body, it may feel like, well, I'm just going to forget I have that part, or
Mhm.
and so that does make it more challenging.
And the one thing I want to the one thing I love about what I've learned in the last few years, um, working with a bunch of neuroscientists and stuff, is that your brain and your neural nets never stop being able to transform and learn.
Yeah.
That's a lie to say you're done learning at a certain point.
Hmm.
And so what's so hopeful about if you spend a
Yeah.
lot of years being disconnected from parts of your body for a wide variety of reasons, they don't even have to be disability. They could be trauma,
Right.
they could be all sorts
Oh
of things,
yeah, absolutely.
right? And is that your brain can actually relearn to hear the body,
Hmm. Hmm.
right? Like that's actually something that practice can change,
Yeah.
right? So, um, you know, practicing sensuality, like sunlight on your skin, like your shower, like all those things are literally rewiring neural nets,
Yeah.
and
Yeah.
that matters.
Hmm.
And we're not, as we get old, I feel like I'm getting pretty old right now, and I worry that my memory is not going so good lately, and it's like, oh my God, I'm just rigid, and my neural nets are collapsing into dust, and it's not true. It's not true.
Yeah.
I can still learn stuff. That's a really good thing. One of the things in our conversation, we're talking about this. I think this is like a thing that's kind of gets to the societal stigma
Hmm.
that pleasure and self pleasure is an okay thing to pursue, right? Say more about that when we're talking about that.
So, I mean, actually, one of the things that I talk to folks who have new injuries. So I do like um, the sexuality topic for our new injury class, and I always mention self touch or masturbation, because it's a way to sort of relearn your body after a traumatic injury, or whatever physical change has happened to your body. And so that may not be genital stimulation. It might
Right.
be, people definitely have cultural, sometimes spiritual, religious prohibitions around masturbation. And I'm not here to change anyone's values or beliefs around that. But there's also an aspect of sort of relearning the like the physical landscape of your body. So learning that, oh, this part of my body was never really sensitive before, and now it kind of is. And it I don't want to touch that part. For instance, I had a gentleman in my yoga class recently who just joined, and we were doing like a neck brushing motion. And he said, I can't do that one because I have hypersensitivity there. Great. I'm glad to know about that, you know, but somebody dealing with a new injury, you're figuring out like, oh, this part of my body, who knew that this was going to be an erogenous zone, but it feels really good when somebody touches that part. And so that might be, you know, this different kind of thing. And knowing your body well, even kind of what positions are more stable for you or more comfortable for you pain wise, those things on your own, you know, that investigation can help you then feel more confident in exploring intimacy with another person.
Yeah, so I'm going to ask you one question, and Bethany, I realized that I forgot to have you do the housekeeping and telling people how to raise their hand. So in a second, I'm going to ask you to come on. Okay, so be ready to give that talk. So be like 2-3 minutes. One of the other things I have here, and I think this is one of those things that was a big change for me years back. Not so much about disability, is recognizing that intimacy is a form of communication in and of itself.
Mm-hmm.
Right, that when you start to like having close contact, whether it's sexualized or not, allows you to hear a person better in other contexts.
Oh yeah.
So talk a little bit about the communication issues you see, like whether it's talking about it or recognizing that it's a form of communication. Or
Yeah, well, I mean, definitely within a sexual intimacy context rather, you know, I see people maybe trying to please a partner and, you know, sort of engage in sexual activity when they may be experiencing pain or not as comfortable with something, and they're doing it anyway because it's to please their partner or because they think that's what their partner wants. And like I said before, you know, people just don't have practice talking about these things. And so I definitely, you know, work with folks on, well, you know, how could you bring this up? Or, you know, what would it be like to have this conversation? And like, let's practice together. And thinking about, you know, when you might communicate some of those things to your partner. Well, it's not like while you're naked in bed, like maybe while you're having coffee in the morning. Well, you know, the other night, you know, I kind of wanted to bring something up and let's talk about it, right? When it's not so like emotionally charged. So yeah, does that kind of.
yeah, for sure.
Yeah.
And also, again, you know, and there's that issue about figuring out strategies to talk about things, because I can tell you, I remember when I was first injured, it was right at the same time. Oh, for God's sakes, I'm forgetting the name of the movie. John Voight and Jane Fonda, Coming Home.
Oh yeah.
Coming Home, right?
Mm-hmm.
And I remember that was the only imagery I had about how, and I'm young and I'm like, and I never had a sexual encounter. Like, okay, so how do you figure out how to do this? And the fact that like you, in a way, you do have to, unfortunately, spontaneity is not something that is as accessible when you have a disability.
And I want to say something about that, because you gave me an idea the other day when we were talking about this, and I love it as like this positive reframe. So you're right. There's somehow in our society this value on spontaneity, and oh, we're just gonna the spirit takes us and we're gonna rip our clothes off, and you know, and that's supposed to be the exciting thing, right? The exciting way to have sex or be sexual. But you're right. So people, you know, who live with physical disability, you may want to take your pain medication half an hour beforehand so that you're really feeling comfortable for sexual activity. You may want to make sure your bowel and bladder emptied. You want to make sure that you know, other care needs are taken care of. Maybe you have a caregiver that's like on standby if you need something outside the room, like all these different things, right? Taking an erectile dysfunction medication, that takes some time to kick in. So the idea that you gave me is to think about planning sexual activity as being intentional about it. So rather than, oh, it's not spontaneous, but that it's intentional, like we're deciding to do this, in an hour. So we're going to do some things right now.
Yeah, and also
I
like
just
the
love that
fact
idea,
faster, especially when it comes, the idea, unfortunately, one of the stigmas I think that are in our culture is somehow that like that somehow more friction is actually the only way to pleasure. In fact, that's probably just patently freaking false,
Well,
right?
and anybody
That
who's
stretching out time.
done yoga with you, knows that that's not true.
Yeah.
I mean,
Yeah, that time is not the enemy in an encounter, in an intentional encounter. Like it's actually part of the, can be reframed in a part of the launching and the beauty of it, right? And but it does take conversations.
Exactly.
It does, like, that I remember, whether it's about sexuality or not, there's always that point, especially in an intimate relationship, but also with friends. Like if I was going to go, on a trip up camping, let's say, whoever's I'm going with, I'm going to have a conversation and a series of conversations
That's a
about
good,
what that looks like and what it is.
right.
And they're not easy to have, right? But they're important ones to have, and they can be part of the process. And you're right, it's probably not the best thing to do while you're already in bed naked. Like there are those conversations maybe
right.
somewhere else, right? But for sure. Okay,
People,
so I wanted to go ahead.
yeah. No, I was just going to say, I mean, just the spontaneity thing. I mean, people, I think people who are dealing with a new injury often complain about that, like, oh, I can't be spontaneous anymore. But I think also, I mean, two things. Number one, a lot of folks living with disability, there's a lot that has to be planned, right? I mean, just daily living, is planned around certain care needs and that type of thing, or around pain, or, but I think also when you take that intentional approach to being sexual, as soon as you sort of set that date, okay, like 6 p.m. tonight, whatever, that's where we're doing that. That's when foreplay starts, right? So, I mean, there are advantages both ways.
There are ways to do that. So Bethany, I have a question for right after you do the house cleaning thing, as people are thinking about their questions, but come on and tell them how to rate, because we're going to do that. We're going to open it up for questions now. And this could go for the last 45 minutes, man. Hopefully you have a lot of questions, because there's a lot of ground to cover if we want to, or comments. They don't have to be questions. And we want to try to organize this. So Bethany, why don't you?
All right, hello everyone. So for today's kind of question and answer section, we are planning on, we will keep, right now Matthew and Sarah are spotlighted, and we would love to bring you on to spotlight as well when you have the question. And the way we'll do that is through raising the hands, but raising hands on Zoom. So we actually see your digital hand being raised. That'll be the easiest way for us to see you. If you don't know how to raise hands on Zoom, you can go along to the taskbar at the bottom of your Zoom screen, and there's something that says reactions. You can hit reactions and then raise your hand from there, and that will kind of develop a little cue for us to follow and be able to call on you. And just so you're aware, when it's your turn to come on, I will add you onto the spotlight and then take you off. So when the question's being answered, it'll just be Matthew and Sarah on the screen.
And if you'd rather not appear when you ask your question, write it in the chat box, of course.
Absolutely. Yeah, you can let me know that too.
But in fact, by not having you just have to stare the whole time at Sarah, Dr. Brindle and me, that might make it visually more interesting, right? So part of that's what we're thinking about. So we got things you got covered, or is there anything more you need to say?
I think that's it. Yeah.
Okay. All right. So start, raise your hands or whatever. One of the things that, again, I want to try to put this a little bit into yoga, mind-body context too. Whatever the touch on the whole continuum, sensual, sexual, more than a physical frictional exchange, it's a pranic exchange. It's an energy exchange, right? And when you open it up that way, then your abilities, whether or not, the idea that, like for a male, you have to be virile for this amount of time and as long as, you know, whatever. No, actually what's occurring is much deeper than that. Right? That like there's an exchange going in and out of your subtle body. There's a whole bunch of things. There's the relationship of the chest in relationship to certain sensations. There's relationships to different parts of your whole body that aren't only defined this way, right? So like, for example, in a non-sexual context, but then it could be sexual. Don't forget that your bones, not just your flesh, are integral to the movement of prana in your body. So when you're sitting in a chair and someone pushes their hands on your knees and you go up and feel the rise, it's because the pressure is being delivered down the bone and moving through your body, right? So there are ways to explore and realize your body that allow for many more conduits of sensation and whether or not you can feel this. Right? Because like I can't feel this as much as on my foot, but if you push on my heel, I'm going to feel something way more than just touch the skin on the sole of my foot, right? There are many different ways of figuring out how prana and sensation are exchanged, right? And that's part of what makes it the great mystery, right? And an exploration to engage in with your partner, right? Because it's all different people are calibrated different ways. All right, does anyone have a question yet?
I want to respond to that.
Yeah.
I mean, I think that, again, you know, this is something that our society's view on, you know, what good sex should look like just completely misses the mark, you know, because it is, you know, orgasm focused. It's, you know, it has to be this or that position or whatever it is, right? And you know, it's often not an experience that is focused on that sensation. It's focusing on like an end result, or and what you just described is something that would take time, you know, and really,
by definition,
really paying attention and having that awareness. And we don't get that a lot in our lives.
So like, for example, and this is like would be a yoga thing that we do to try to help someone feel the sensation of balance. Okay. If someone very gently, especially for someone that's seated that is lacking some balance, takes their hand and puts it between the person's shoulder blades, what that does is creates a sensation of relief, not only of other that you can trust, but a sensation of relief that actually changes the feeling and sensations in your sitting bones and by the base of your spines, which is actually allowing you to be open there in a way that in a yoga pose allows you to extend down through your inner heel. Okay, that junction place is one of the junctions, but the interesting is that the support of different parts of your spine comes from different parts of your spine. If you want to support between the shoulder blades, you might actually ground my hips, right? You might actually give reference around the hips so I get the sensation of relief at the base of my spine so I can lift my chest with less effort, right? But learning that kind of inner mapping about how awareness travels through the body, it helps everything. And it's going to help your balance, and it's going to help a whole bunch of things. All right, so I'm hoping someone's ready to take the leap. There's one hand up. Bill, I knew I could count on you. All right.
Unmute, I guess. You're gonna unmute. Thank you. Hey guys, thank you for having this conversation. It's really critical. I vaguely remember my first sexual event as a child. I was paralyzed at 58, 56, anyway, 10 years ago. And I graphically remember my first sexual event as a paraplegic. It's, I mean, the intensity, the scope was somewhat, I felt cheated, not knowing what I know now. for the first 40 some years of my life.
So Bill, you got to try
Say
to
more
help
about that.
Yeah, try to describe some of that. Don't get super graphic, okay? So
yeah, you know me. I'm pretty reserved. So first hand up. So anyway, so when I was in rehab, I had 8 rehabs in my first 6 years of being a paraplegic, and most of them from some major stuff going on, cancer included. But so I was dealing with a body that was so erratic and so changing that when I was actually coming out of some chemotherapy, I thought, wouldn't it be nice to have a partner to share the rest of my life? And I just laughed because I was in such, I couldn't think of just how am I going to get out the door? I couldn't keep clean clothes on me, that kind of thing. And so all of a sudden, the opportunity to actually, start dating came up. And wow, the first time was the most amazingly awkward event in my whole life. I had no idea because my options in rehab were 3, an implant, erectile medicine, or nothing at all, and there wasn't even an option 4. So to be able to bust through that was important. The depth of the orgasm was, I would say, 100 times deeper than just the physical piece of orgasm, because I didn't open up any other opportunity that it wouldn't be any more than ejaculation, that it could be, other than that initial rush and, a cigarette after, kind of thing. But it was it was incredible. Now, what has happened in the years, because I'm a T4 paraplegic, and I lean too far and I'm on my face, and that kind of works sometimes, doesn't work all the time, but and I'll just leave it there. But I was now my neuropathy comes in, so there are times when somebody touching me lightly on my skin is like somebody taking a torch up and down my arm, and to navigate that. But the ability to actually have somebody that understands, as you said, where I begin and where I end on both sides of it, so that you can actually envision and actually accomplish those boundaries coming together and integrate.
Yeah, there is no merging without a realization of boundary. And that's part of what is like one of those paradoxes that happens in a yoga pose, but it also happens in an exchange.
In talking about it, it was, I didn't realize, or I wasn't ready to be able to be that intimate with somebody when I was fully functioning, or whatever that means, when I was walking and running. I mean, it was so limited to the constructs of which I was brought up that, without having them thrown out the window saying, okay, that ain't working. So, what can it be? And just being open and safe and is a big word too. And I'll stop.
Do you have any other? The other thing, Sarah, Dr. Brindle, why don't you? I'm working on it. Damn it. Do you have anything to respond to that, or any?
I thank you for sharing that, Bill. And so many things there. Awkward. We talk a lot in my classes about just being able to laugh at yourself and experiment, and know that first time is probably not going to be great, but it's going to be a leap into starting to feel more comfortable. And then the other thing that you mentioned about the neuropathy coming up just made me think of another aspect around, and this is kind of the opposite of what you're talking about, but being able to sort of use differences in your body for sexual pleasure. So for instance, somebody who has a tremor or spasms, maybe that's not a bad thing in the context of intimacy. Maybe that's something that you start spasming and, you know, the person lays their hand on you, and that's a grounding thing. Or there was another example I had of that. Just, you know, somebody who maybe has a hand contracture and can't, you know, touch somebody with their palm. Well, maybe you're touching somebody with your arm like this, right? Maybe you're using your elbow, maybe, you know, so really thinking creatively about, you know, how you're sort of using your body in that exchange.
And the thing is, I also think that that's part of that can enhance the communication, is that you
Yeah.
start to become on a journey together of not just trying to make the disabled person feel like they're being adequate sexually,
Yeah.
but the new adventure of the new context
Yep.
that happens because of the differing abilities. Quite
Yeah.
frankly, I'm going to tell you that I think with practice, spinal cord injured people or people with neurological deficit can actually feel more of the pranic subtle body than an able-bodied person. And that can actually show things for the person receiving, because most of the receiving happens in the empty space, not the colliding space. Just like Shavasana nourishes the empty space, there's the empty aspect of sensation is the shared part of sensation. That's why I think that what Bill is saying about, in a way, was way better. It's because his new situation made him realize the full dimension of empty and full sensation. And our bias has gone towards the physical. And we're missing the empty, the contentless part of shared sensation. And that can happen only in the context of conditions of safety and a dynamic where communication is good, all those things. Poppy, I see your hands up.
Yes, my name is Matthew Sanford. I am a person that has spastic quadriplegia, cerebral palsy, and I definitely, and I've had able-bodied partners, and I've had various partners with disabilities, and I honestly find for myself the partners that I have the best fun with, the best sexual experience, whatever that may be. And again, that doesn't have to be the standard social paradigm of what that is expected to be. I have more fun with actually partners that have deficits, because there is more conversation. There might be more planning. And as I'm getting older, I'm finding my body change and has changed and is continuing to change. And at first, to be honest, I was very frustrated about that. But now I'm embracing it to have this new adventure. What is my body now versus what was it when, you know, I remembered X adventure or fun. And also for someone who is a non-traditional individual in relation to intimacy, who is kinky, building good conversation is paramount for me, period. Regardless of what dynamic that is. And I find that is honestly where I end up having the most fun, is where I make those brave connections, those brave conversations with my partners, be it whatever gender they be, whatever capability they be. But I find it is the best connection that I have is honestly people that take the time to listen, not just to me, but also I listen vice versa to them.
I think that's part of the insight that maybe sexual expression, sexual intimacy is a particular form of communication, an important form, but they all travel together, right?
Very true.
Good communication, listening to each other is part of what it is to listen to a partner. Dr. Brindle, you want to say something about that?
Yeah, thanks for sharing that, Poppy. And you know, I definitely have heard, you know, other people with disabilities say kind of similar experience in terms of, you know, sex is more more fun, more meaningful, more, you know, after disability. And I think it's related to a lot of the things that we're talking about, the the sort of increased intimacy and with that the vulnerability, but also this sort of creativity and being open to trying new things. And then to your point about, you know, being, I can't remember the phrasing that you used, but you know, I feel like folks in the queer community and, you know, sexual minority communities do tend to communicate better and more directly with regard to kind of sexual boundaries and, you know, interest preferences, you know, and I think we can all learn to do better with that.
Yeah, one of the things too about the changing body and stuff, like realizing the full dimension of sexual exchange as a subset of energetic exchange, right? Like it's kind of what I'm trying to say is developing your ability to hear all of it. This is not just an issue of disability. This is an issue not only is lacking in all healthy sexual contact or could be improved, but also just it's a pretty good plan for aging. Right?
Definitely.
When we will encounter physical changes. And the idea of being able to see, like, for example, supporting somebody, not just behind their back, but let's say just putting your hand against their sacrum and giving them the sensation of relief, right? That's wonderful. That's the kind of bonding energy. It needs to go nowhere, right? But when it's in a context of a partner that you feel open and caring with, then even those touches that are supportive are also wonderful. And it feels good to help someone else feel good, right? Like that's also part of it. I heard this wonderful thing, dang it, now my brain is fading into where I just heard it. Oh my God, in the show Afterlife, the guy, Ricky Gervais, oh my God. But the line was, like something, because it's a long story, but he's suicidal, his wife has died, and he's talking to a woman who lost her husband, and she says to this guy, don't you know that happiness is magical because it's an emotion that it doesn't matter if it's yours or not, right? That it's one of those things that you feel happy when someone else is happy. What if exchanges could be like that? Like there are ways in which, like, there's all sorts of ways that this can go, right? And part of it is getting past some of the stigmas. Does anyone else have any comments or questions or remarks? Anything in the chat there?
Matt, this is Amy. There was a question in the chat. What is the difference between sensual and sexual touch?
That's for you, Dr. Brindle.
Yeah, so I would say, you know, sexual touch is you know, considered more in that context of an intimate relationship. Sensual touch, I feel like I do that all the time in nature. This is kind of about, like, nature is my thing. And so the other day I was taking a walk during my lunch break, and we had this beautiful patient garden that, you know, there's gardening classes, and they have raised planters for folks who are wheelchair users. And anyway, it's a beautiful spot. And I saw these pansies flowers, and just this gorgeous purple. And so I just like stopped, and I like bent down and like just felt this petal, you know, this pansy petal. And it was just like, it just felt amazing. And just having this moment of this sensual touching of this flower petal. And so I don't know, Matt, if you have comments in terms of the mind body yoga part.
I think it goes back to something that you said too. I mean, sensuality is exchange that isn't driving to a certain point.
Yeah.
Right? It's like for its own sake.
I didn't have a sexual attraction to the pansy.
Yeah, well, yeah.
Great.
You know. Unfortunately, the way attachment goes, it could turn not for you, but that can turn into like a fetish, right? Sure. Because a fetish is actually, when you think about it from an attachment point of view, if the fuel of attachment is actually your subtle body and your subtle dimension, right? You could see how it could get fixated on objects because you actually, that was not that I want you to suddenly fall in love with pansy petals, right?
Well,
but like it actually moved you, not just your mind, but you could feel the whole thing.
Yeah.
Now that has to go nowhere, and it can go.
There's no agenda. There's, you know,
right. And so like the feeling for me, like it's incredibly sensual to let and allow the touch of sunlight on my skin, or something that, and my skin is probably more where I feel the sensual thing, and it doesn't translate as much for me directly to what is sexual until it enters bones and stuff for me, right? But the softening and the feeling. So like for me, for something to be, and so my ability, one of the things I would say is that it's not driving to an end. And in a way, I feel like if you had overtly, and I would say, I'm just going into your experience, I don't know if this is true, but if you had overtly and premeditatedly turned that into a sexual experience, I think you would have been with the flower petal.
Yeah.
I actually, you know, I think you would have been diminishing the exchange. Right? Like to put that sort of construct and driving it to a certain place is actually not the way. So has anyone just seen a beautiful vista and feeling it through your whole body? Like that feeling of being in nature, going like, oh my God, this is so beautiful, right? Like that's a skill to develop. Like even when I'm telling you this, I didn't even like see a certain vista, but I let it go through my whole body. I know what that feels like. I know how to repeat it, right? And it doesn't have to be driven to a particular point. So to me, one of the things that exchanges, that allows empowerment too, is you get to choose how you receive it, right? Like if you want to drive it to a certain point, drive it to a certain point. Don't drive everything to a certain point, because if you drive everything to a certain point, kind of like what Bill probably did a little bit with sexuality before his injury, right? You end up missing like 4/5 of the world.
Yeah.
Right. And it's like, don't. And so that's where, but how you decide to take it and focus it, right, is actually being able to make those choices, like with the sensation of relief. The way you're going to get better at making those choices is to practice them. Like take a beautiful experience and try to bring it inside your body, not just inside your head. Make sure, like, for example, when you're seeing something beautiful, like for me, it'll be really good if I ground my legs when I'm in the presence of beauty. Right? Like if I ground there and make sure my spaciousness has a boundary, then I can let it in better. Right? Now, there's no way that would have to be sexual, right? But I could try to put it in service of that. Like if that's what I wanted to do with it, I could try to go, yeah, as like the walk before you take the Viagra, whatever, to before you plan the thing, like that could all be part of it. Like one of the things that I want to get better at sensually in my life is actually, I want to get better at tastes and food. Right? There's an avenue of exploration that I'm very curious about. Right? And it's like, I got so much work to do there. Right? Like, and so that's like one of those goals where I would say that's where I think that the way I'm going to do that is try to make it more sensual. Right? Like, and so again, it's kind of the context that you choose.
And I think, yeah, like this idea of savoring something, savoring food, savoring drink, savoring the sunset, right? So like, I think that word sort of brings up different connotations, rather than just like awareness or mindfulness, right? But like savor it. So that it like that automatically causes you to slow down and pause, I think. And kind of what you're talking about, Matt, in terms of, you know, exercising the savoring of food and, you know, the sunset and the grounding and all that. I think if you are more regularly doing those things, kind of noticing sensuality in your life, that can translate to, more like a more expanded and deeper experience when you are engaging in sexual intimacy.
And that, I think that's how like a mind body practice can be an enhancer of whatever you do. And I think that there's something that a line that Big Zangar said that I take on a lot of different levels, one of which is also can be into sensual expression. I know I've become a more sensual human being since I've started practicing yoga. There are so many more things that I notice, right? I also know that my appreciation of sexual intimacy has enhanced because of my yoga practice, right? And the line that he says is in the context of religion, when he's asked, is yoga a religion? And his answer was, no, it's the science of religion. Meaning that when you integrate mind and body and whatever you call spirit into a unity, it will fulfill and enhance whatever beliefs you already have, right? It can go in service of your Christianity. It can go in service of your Muslim religion, whatever. That's not what it's about. The integrative act, the becoming aware of the happening and the full dimension of the happening and what's not happening. That itself is a sensation too that applies to sexual exchange. Both are occurring as sensations. Like though, when you become aware of all that dimension, then your yoga practice can help you with that. And then you get to decide what to do with it. Right, in my opinion. So Poppy, your hand is up again.
Yeah, I just kind of want to echo what you said, Matt. And I found this through, honestly, it's going to sound like a little bit of a fetish, but it's not. But the fact that I am a foodie, the fact that I take the time to enjoy my food, obviously when I'm working, it's basically find the quickest thing possible because I usually only have, if I'm lucky, 15 minutes. And sometimes it's non-existent for like an actual lunch. But I found myself taking the time to, and it wasn't in like mentally aware of the intention, but I was noticing because people kept commenting when I was at home, you're always the last one at the table. Because everywhere else in my life, it's always go, 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 here, here, here. This is what's got to get done. Multitask, get the job done. But when I'm home, I purposely was unaware, but I take that time to have a sensual relationship with my food, to engage back in to my own body and my own environment. And I have totally agree with Matt's statement, being a yogic practitioner, it has helped me be not just connecting more to my body, but in the relationship to intimacy, being a better partner, being a better connected, being more willing to risk and try and have fun and be stupid, be silly, have things epically fail and laugh about it.
Yeah, and I think that ability to transform your relationship to time is part of what we're talking about here, right? That if you do slow down, guess what appears? Like everything, right? Everything was already waiting for you, right? It was already there, right? And I think that's part of it too. One thing I want that we didn't get to this, but Sarah and Dr. Brindle in our conversation, we talked about like, and I think there's an analogy here to why people won't use yoga props, right? Because somehow they think it's not but sex props are okay, right? I mean, like whatever works, whatever pillows, whatever position, that's all part of the conversation. Say a little bit about that.
Yeah, so I mean, there are props that could be used in yoga or in sexual intimacy. They're exactly the same things. So, blankets, bolsters, straps, like all the things that you might use in a yoga practice, or more specifically in an adaptive yoga practice, could all help with, positioning, with comfort in a certain position, with, kind of having a support, especially, for somebody that doesn't have, or somebody that has balance issues or, trunk control issues. So there's that kind of type of props, but then also, sex toys or, sexual aids. They used to be called marital aids, but
Really? That's hilarious.
yeah, they did. But that could be things like vibrators. It could be something where, you work with your OT and get, like an extension for a sex toy so that you can reach a body part better, or, that type of thing. Something that, basically like extends your reach or allows you to do something that maybe is more difficult with your hand, but you can do it with a tool, or, that kind of thing. So really thinking creatively about using those things. I did want to mention, and somebody had asked a question in the chat about resources.
Yeah, I was going to ask you this.
Yeah, so this kind of fits in with that. So I have one book that I will recommend. This is actually an old edition, but the latest one I think is 2016. So it's The Ultimate Guide to Sex and Disability. And so this one's kind of a wide ranging, and I just wanted to show one that there's like some pictures in here, and they're just like cute. And so this is, these two people being sexy, one person's in their wheelchair and the other person's just on top in the wheelchair. And it's okay, Enabling Romance. I see that one too. There are a ton of books out there. This one's pretty practical and covers a lot of different areas, a lot of things that we've talked about today. But they do have a whole chapter on sex toys, books and videos, communication, sex with yourself, sex with others, and kind of those universal things that could come up. And then the other thing in the chat is a fairly new website that's focused on spinal cord injury, which is, my area of expertise. However, I think there are maybe 10 or 15 videos on that website, and many of them would definitely be applicable to other folks with mobility impairment. So it covers things like, orgasm and positioning and communication within relationships. So definitely check that out if you're interested. The videos are like 10 to 15 minutes each, I think. And just something good to have ideas. And then the other thing that I would say too is that, whatever medical condition that you are living with, or that your loved one is living with, pretty much everything out there, I mean, the internet has gotten much, much better about people being willing to share their stories. And I think sex really is something that people are talking about more within the sort of medical community. And so if you were literally Google multiple sclerosis and sex, or Parkinson's and sex, you will find something there that would address specific things related to the condition that you're living with, because there are other things that might not be that present for other folks. So
Amy, you have your hand up.
Yes, we had a private question come in that I'll read. I have progressive MS and have been paraplegic for a few months, but have had bowel and bladder incontinence for several years. My husband is my caretaker. I've become too ashamed and embarrassed for him to see me naked now, as he's used to cleaning me up, and my body has changed so much. I'd appreciate any advice. She says that he sees me naked all the time when he's cleaning me, but now she's living in she's embarrassed now.
Mm-hmm.
So that's what I mean by your body getting medicalized, right? Dr. Brindle, you wanna? I've got things to say about that, but I'll let you go.
Yeah,
first.
I mean, it can be really challenging when your loved one, partner, spouse is your caregiver, and yeah, that can be tough. And I see that a lot, in couples that I work with. And mean, I think number one, that communication aspect, if possible, to communicate and share some of those things with your spouse, I think can really open up that discussion. And I mean, these things, it's like the elephant in the room. So if you're not thinking about it, the elephant's not going to go away on its own. And so finding a way to discuss that and kind of talk about those changes, and they're very real. So you can't ignore them. These things are happening. I will say that in terms of the caregiving aspect, some people at a certain point do decide to have a separate caregiver be the person who is dealing with bowel and bladder care, doing other sort of intimate aspects of care, so that it's not your partner doing that. But obviously financially that doesn't work for a lot of folks. And if you know, you're having bowel accidents, you can't just call the person and say, okay, oh, can you be here in half an hour? Great, I'm going to sit here and wait for you for half an hour. So not really ideal, but I think first and foremost, the discussion sort of.
Yeah, and I think that there's not going to be one actual panacea here, you know, one silver bullet, but I do think that there, you know, maybe you're already aware that, are you for sure aware that the problem exists in the same form in your partner's head as it does for you? Okay, so if you know that there's a difference there, that's a good start for communication. Like in some ways, thank goodness if it's only in your head, because I suspect that loving partner, his love currency or her love currency is fantastic, and for them it's not as big of a problem. So the good news is if it's only in your head, then you know, we only really get to change ourselves. And so I kind of hope it is only in your head, right? And that the love currency is transcendent, right? And I think it probably is, would be my guess, if you are living in that situation. Secondly, there might be a way to ritualize separation, right?
I was going to say that too.
Yeah. So go ahead and jump in there, Dr. Brindle.
Well, yeah, I mean, you know, even something silly like, okay, when you're in the caregiver role, your name is Jacques or something, right? So like there's this clear delineation between right now I'm the caregiver, right now I'm your partner, you know.
Could be as simple as clap 3 times really loudly, like literally change the space. Light sage, do something that actually marks a distinction between roles. I mean, that's what we do at the end of the day. The people that struggle with work-life balance are the ones whose work never stays outside the house.
Bleeds in. Yeah.
It bleeds. It's like, so do some stuff to ritualize the separation, right? And especially if that's the problem, and then in relationship to your own head, like you can work on that probably by letting your loved one talk to you and say, guess what? I don't see it that way. Right?
I like the idea of having it be something physical.
I think it's important to make it physical. Yeah. I don't think this is a conversation only. I think the boundaries, remember, most boundaries are actually illusory anyway. So, I mean, if you're a radical yogi, you think all substance is actually an illusion. But like, honestly, if you listen to whatever you create as the boundary, it can actually be a boundary. Now, if you're more worried about incontinence, like during the act, well, this would also be a place to explore. Maybe it doesn't have to be just traditional sex or that encounter. Maybe, don't forget, like their whole like body modalities, like Reiki. Now think about the implications of Reiki. The sensation, create sensation and effect without direct touch. What if the dimension in empty space actually reaches into your subtle body, especially when it's shared by another person? So there's a whole bunch of ways to, and I think this is going to be the key to sexuality and the continuing process of aging, is to recognize the dimensionality, that it doesn't require as much physical contact, right? And so the fact that there are stuff like that, and part of it, so when you're being ashamed, you're talking about that as being ashamed. I get that as a sensation for sure, right? For sure, okay? But that's a symptom of your conditions of safety not being met.
Mm.
You're having a violation of your conditions of safety. You're processing it as shame, right? Or this may be what's going on. Maybe there are ways to work on conditions of safety, right? That like, maybe it does have to do you being incontinent or whatever. And so maybe you don't, who knows, but maybe conditions of safety can be met a different way. Maybe there's ways to, well, just think about what it is when you feel safe, right? Like in that context, because guess what? Your caregiver loves you, right? If he or she wouldn't be doing that if that weren't the case. The conditions of safety have already actually been met. It's whether you allow them to infiltrate or penetrate or seep into this thing that you're uncertain about, right? And again, I mean, there's so much touch for you to enjoy that doesn't have to include the circumference, the circumference around the base of your spine, right? It doesn't all have to be about the down there, right? Honestly, right? And so that might be a great opportunity to explore some of the other dynamics too, right? So again, how you solve the conditions of safety problem.
And we haven't talked, I mean, we have talked about it sprinkled in just in terms of that continuum of sexual expression. And yeah, it doesn't have to involve the genital area at all. Like it really doesn't. If you are with this person that you're in an intimate relationship with, there is this physical touch that is maybe sensual, but also within this context, right? But you know, I was saying something earlier about, you know, other ways of sort of expressing yourself sexually, and it might be, you know, oh yeah, somebody just said head massage. Oh my gosh, yes. You know, so it might be exploring those kinds of things, but even thinking about folks who aren't in relationships. So, you know, putting on some perfume or cologne because that makes you feel sexy, right? Wearing your favorite, you know, scarf, you know, wearing your clothing of your favorite color, or something that, you know, we were talking before the call about a lot of folks after a new injury feel like all they can wear is sweatpants because it's, you know, they're easy to get on, and you know, it's just comfortable and easy. But you know, there are many clothing companies now who are catering to folks with disabilities, and you know, making clothing more accessible and fun and stylish. And so being able to express yourself in that way as this person that can feel sexy and good about themselves. So that's all kind of like wrapped around it as well.
And there's so much, I mean, a couple of things I want to say, but there's also so much to, like when somebody does do that, and as your partner is wearing that, to actually notice. And I mean, because of your love practice through your life, like, you know, the inside of that other person too. So to be able to hear them go, wow, that looks really good. It's not just an outside comment, say that as an inside comment. Whisper stuff that's true, right? About how beautiful they are, about what you see. You see the magic of your partner in a way that nobody else does. Let that be part of your communication. Make it sensual, make it the hidden thing that only you see, right? Like, and that is a tremendous gift that creates the openness for curiosity and exchange. The other, like, more pragmatic thing, and then we need to close, and then we'll stay on after. And this conversation went longer. I think it's an important conversation. Maybe we can have it happen again, because I think that we didn't quite, I kind of want the next round.
Oh, there's so much more we could talk about.
You say and ask more, but we're trying to get the conditions of safety for you on Zoom to be able to ask for. But one of the things that, so I can feel sensation through my whole body, but it's not physical in the same way. And they wanted to, there's a guy that was doing MRI studies at Rutgers University that put my head in MRI and were pushing on my feet and blah, 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 blah. And he was doing, it was interesting work. He was doing that because his wife had died of cancer, and he saw the excruciating pain that she went through without any kind of drug that they developed, right? And he was trying to study the release of endorphins and chemicals that he thought were occurring in orgasm, right? That might be used and figured out to molecularize into a pain medication. And so he was doing a lot of mapping of the parts of the brain in orgasm and what was being released in the MRIs. And the people that were many different people going through there and watching what part of the brain was activating. But most of the orgasm had no physical component. Okay, that's what they were watching. And guess what? The brain does exactly the same thing, whether there's actual touch or not. Okay, so, and now I'm not just talking imagination. I'm talking explore the difference between physical orgasm and pranic orgasm. They're different, and they're very different, and they also can be combined. They can be simultaneous. But I think you'll find, I think this is what Bill was maybe saying in the beginning of the call, is that the realization of energetic or pranic orgasm is actually more important and more affirming and more intimate than the physical one, right? And that has to do with listening to the exchange. Those things, you know, it can be an image, it can be a touch on the palm, it can be all sorts of things. It's you being able to let that sensation pervade your entire body and then find a rhythm with it, right? It's an energy exchange. Unfortunately, I think the genitals are just caught in the crossfire of what's actually occurring. They're like the casualties of how our society conceptualizes this and thinks and tries to explain the reality of it. No, actually, it was never about the physical organs. That's never what it was about, right? And I think that there's wisdom in our community living with disability that actually our whole culture needs.
Agreed.
In a huge way. So us finding our voice in relationship to this and putting it to wisdom, it's a service. It's a service that our culture, our kids need it, man. It's gotten overly sexualized way too fast. They're missing the magic of it, right? It's a collision. So hopefully they grow out of it. But we better stop there. We're 5 minutes over. I'll stay on. I don't know if Dr. Brindle will be able to stay on. She's already given us an hour and a half out of her day.
I'm here.
We'll stay on for in case there's questions that are wanting to be a little bit more quiet. Instead of 42 people, there'll be 21. Might make you feel better. And we didn't do a practice this time because I think this is a conversation that will only get better as it's given more time, right? This is a hard one to talk about, and we just need to. All right, everybody. Thanks for coming to this. Remember, oh, by the way, there's an email coming to you that gives you all the different ways to step closer to mind-body solutions, including Kiss My Asana that's coming up in April. But literally, check out some of the things we offer. There's a lot of new people on the call. Check it out, right? That's why we do these things. And then there's another one of these on May 1st, I think, or whatever the day was. All right. Take care, everybody. Namaste.
Bye.
Can I just offer a little bit of my experience?
Yeah, for sure, Dave. I was waiting for you to chime in.
Well, I didn't have questions, or I'm nearly 4 decades living with a spinal injury. I was hurt when I was 25. And when I went through rehab at Courage Center, they actually took us to a 3-day seminar. I was bused to the University of Minnesota, and we had Sexuality seminar for 3 days. And it was like a desensitizing experience. And in some ways, yeah, I'm actually kind of curious whether is that still going on, was it a unique experience for the time. But for 3 days, they had folks come in and talk about their sexual experience, whether it was a gay experience or it was living with a disability and with a partner, or it was a huge just sensitizing experience. And it was a huge benefit for me heading into my new life at 25.
Oh, that's cool.
That's amazing. And
Yeah.
I'm really surprised to hear about that. I mean, it's great, but yeah,
I never got anything like that. I got
that's
the-
unusual.
Yeah.
I mean, more often I have talked to folks who, were injured 20, 30 years ago, who basically said their doctor looked right at them and said, sorry, just forget about that part of your life.
That was my experience.
So I'm really glad that didn't happen to you.
And when I was 25, I was so focused on becoming a father. I was in some weeks. I was working with my physiatrist towards thinking about how the sperm bank and so
Mhm.
on. So I ended up getting married and becoming a father. So we already sort of started the process of learning how to do that.
Yeah.
Worked for me. But
And it worked. You got 2 boys, right?
well, just one.
Just
Carl.
one. That's right.
Carl is 26 now.
26, man.
That's great.
Congratulations.
Yeah. Wow. No, that's interesting. So it sounds like it was kind of like mentor support. It was people just kind of sharing their experiences and their stories.
For sperm banking?
No, the actual desensitization.
No, the
Oh,
training.
yeah,
that you
no,
went
no,
to.
no. They actually had panel discussions where they brought in like a lesbian couple and talked about sex for them. They had like an hour of like just show or a half hour showing animals having sex on the wall.
What?
Wow.
It was hugely.
That one sounds illegal, but it worked.
Interesting.
So which is good.
They had a film. They had
Very unusual.
he was quadriplegic. She was able-bodied, and they just sort of talked about their experiences and how they engaged in the process.
Yeah, yeah.
So it sounds like
just
what they're
for
trying
3
to do
days.
is reframe the definitions of sex in various contexts, so you could explore newly what yours would be. Sounds like that would maybe the strategy. It makes sense.
Yeah.
The farm animals is pretty intense, though. I'm a little bit surprised that
Well, there's elephants and giraffes.
elephants, for God's sake.
So wait, where was this?
So Minneapolis, I was at Curd Center.
Okay.
We bused us 3 days, I think.
Okay.
University of Minnesota on University Avenue.
Interesting. Wow.
There you go.
Wonder what they do now.
Yeah, no, me too. Where do you go from there? That's part of it.
No.
Like, I'm not exactly sure. Anyone else have any comments or reactions or questions? Or is that the end of this time? I see a lot of people still on the call, but not with their cameras. So I'm guessing
A lot of people saying thank you, that they so appreciate the conversation. They'd like more. I don't see any other questions in the chat at this time.
Okay. Well, go out and explore the human metaphysic. That's my final advice. Because you know what? It's spectacular.
They have a guidebook on that, or
Yeah. I'm going to get one out of my head sometime.
good.
The Hitchhiker's Guide to the Metaphysic, right? And
That's a great title.
Yeah.
That is a great title.
Yeah. So, because honestly, there's so much here.
Mhm.
There's so much here. There's so much potential. Stop
Well-
letting others narrow your definition, right? And go explore day after day.
Yeah.
Right? And I promise you, like the yoga practice, like any practice, it will give back more than you give to it.
Mhm.
If you can stay awake, right? Like if you can stay and not have too many expectations about what you're going to receive,
Yeah.
right?
Yeah. Well, I think, I think that ruins, half of the sexual encounters out there is the expectation,
Totally. Yeah.
I mean, I guess in life in general, right? I mean, we should have some expectations, but I mean, about life, but I would really love to see, in part 2, and maybe people will respond to the email and have, ideas, but I think it would be great to have people share more in terms of, here's what I learned about this that helped me, because I think being able to create that cross communication is so important. And, it's
You could call it Sex Diaries Part 2.
That's great.
Whatever it is, it's one of those things where just like when a little kid like under 5 asks me, Like, what happened? Like, I am
Yeah.
so willing to answer any question that a little kid comes to me with, but I am so willing to open up the cachet to people living with disability, because it's a freaking bear to figure out how to navigate this.
Well, and if somebody can save you, 2 years worth of how do I do this or how do I think about this, just by saying, well, this is how I did it. I don't know if it helps you, but
You don't have to invent every wheel.
exactly.
If I could live by that advice, I'd be much happier. Right? At least I can say it out loud. Right? So, all right, everybody. Thanks for joining. See you at the next one. Be well.
Thanks for being here.
Namaste.